Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello, and welcome to another episode of the Unreal Results podcast. I have a guest, and not just any guest, but a returning guest.
Hello.
Hello. Lex Lancaster is back on the pod with me. She and I thought it would be great to share her experience working with me for some shoulder pain to give you all another example of how the LTAP works in action. And since this week, the doors are open to the online LTAP Level 1 course, I thought it would be a great time to have her come on the pod and talk about it again. And then just so we have the episode for future um, digestion for everyone, because it is such a good example of sort of all the stuff that I have been sharing about the visceral connections to musculoskeletal disorders. And and just to give you an example, I know I talk about a lot like how powerful this work is and how you can really help somebody in not a lot of sessions. In fact, the last episode I talked about how I helped Daniela with her shoulder pain, which was really more like rib lat pain. um in one session she felt 95% better. And so um sometimes it's thinking about that potential outcome, it seems like a little unbelievable, but that happens over and over and over again. And so that's what I want to show with Lex too, is another
Mhm.
example of it just really only took one or two treatments, and that's it.
Yeah.
So anyways, like I said, the this week, when this podcast drops, the doors will be open to the online course, which is a 6-week course. But then also, for a while, the doors to the in-person course have been open to enroll, and the in-person course is November 18th and 19th in San Diego. So even if it's not the week of this podcast, you're watching later and you still want to come join me in the LTAP Level 1 course, there is an opportunity in person. So all right, I think that's enough housekeeping. But
Mhm.
let's I'll have Lex give a little introduction, and then we'll just start chatting about your case.
Sure. So, if anyone is not familiar with me, I am Lex. Alexis is my full name, but I always go by Lex, not Lexi, please. I am a physical therapist by trade, but I don't practice anymore. I do basically digital creation, website design, tech stuff. So that's where I'm at. I help other health and wellness practitioners. I work very closely with Anna as well. So I help other health and wellness practitioners essentially get tech systems in order, do all the automations and course building and etc. Um, I am here today to talk about my shoulder pain that I don't have anymore, which is great. um, I know that, as a PT myself, I had never sought treatment for my shoulder because, I can do that myself. We
What?
know that. So I had never sought treatment. So when I first talked with Anna and met Anna, it didn't even cross my mind to get my shoulder treated, and then stuff got bad. But we'll get into that shortly. So yeah, that's really the gist about me, I guess. I've been to Anna's in-person course and I just take photos, but being on the outside and, watching everything and seeing how Anna does her teachings and then also seeing how she practices is just obviously changed the way that I would practice. So if I were, just for what it's worth, if I was still practicing, this would be the first stuff that I would make sure I dive into more. Just because I see the difference that it can make both on myself, but also on all the people that I've watched her practice and
Yeah.
do treatment on. So
Cool. Thank you.
yeah,
I
of
appreciate that.
course.
Um, I mean, and that means a lot too, because not only, I mean, were you a physical therapist, but you, up until recently, or still do, you teach in a physical
Yes.
therapy program too. So it's not
Yes.
like, even though you might not be doing it, practicing it, like you're still very much a part of the physical therapy industry. And
Yes.
yes, yeah.
Absolutely. Absolutely.
Well, cool. So let's talk about it. So when you finally did ask me to help you with your shoulder, it was, I mean, in March of this year, right? March 2020.
Yes.
Yeah.
Yes.
So we're coming on like 9 months ago.
Yeah. Yeah. Yeah.
No,
Yeah. Oh,
7 months ago.
yeah.
Yeah, 7
7-ish.
months
Yeah.
ago? Yeah.
Yeah.
So 7 months ago, she was in town, taking
Mm.
pictures and helping me with my mastermind course for my mentorship alumni and was like, "Hey, my shoulder's really bothering me. Can you take a look at it?" And of course, I wanted to, but we were also very limited on time because she was only there for a couple days and I was teaching most of the time. And so
Yeah.
but I really didn't want her to leave before I was able to get my hands on her, and so I just did a very quick treatment on her, and we'll
Mhm.
talk about, well, assessment and treatment, and we'll talk about what that is, but a little background on from you of what was going on your shoulder, like, what made it hurt so bad leading up to them, because I think there was, like, even though you might have had shoulder pain on and off, like,
Mhm.
there was, like, something right before you came to see me that really flared it up, right?
Yeah. It was more not it was not anything acute, meaning, like, I didn't do anything and it started hurting, but what I noticed, I started lifting heavier, and
Mhm.
then it really started to bother me. So, it started back in junior year of high school. So, I'm 30, so
Oh,
everyone else can do the math there. So in junior year of high school,
okay.
I yeah, I played softball, and I was the only pitcher on the team. So, I pitched every inning of every game, and everyone will tell you if you play softball or are familiar with softball that the form that you have to throw a softball as a pitcher, it technically mimics like normal motion. So if you have really good strategy, if you have good technique, you shouldn't have shoulder pain because it's a natural motion. For me, I think there's a little bit more like that has to do with my elbow because I have a really, really large carrying angle. So I think that played into it. But also, I never got formal pitching coaching. It was kind of like in ninth grade, I was told that I'm going to be a pitcher, and then I just kind of stayed there. So I never got formal coaching. So I don't think my form technique was great. So anyway, junior year, I pitched every game of every inning of every game. And at the end of
That's
this
what we call the training air.
Yes, it's
Yeah,
terrible.
yeah.
Yes, it was bad. So, I ended the season, and at the end I used to have I don't even know if they use them anymore, but it's like the full ice cuff that, like, literally
Right.
it's literally a sleeve.
Yeah.
And after every practice, every game, I'm, like, in this ice sleeve. It was a joy. So, at the end of the season, I had said, "I can't do this anymore," because I wanted to go to college and play something. I didn't know if it would be basketball or volleyball, definitely not softball, but I couldn't do it anymore, so I stopped playing. So, I had pretty significant shoulder pain the beginning of junior year that
Mhm.
season because it had caught up to me after 3 years and
Right.
then plus all the pitching. So then I will say for the vast majority of the next 10, 12 years, like it didn't really ever bother me so much so that I couldn't do a lot of things. It was only really noticeable if I was doing CrossFit. So any sort of overhead motion in CrossFit would always just irritate it, but not make it so I couldn't do it. I would do it
Right.
anyway. Um, and then I really never had any trouble with any sort of like kipping motions. Like I always thought that it was going to aggravate it, but that never did anything. It was mostly just like being overhead with weight. So
Mhm.
anything weighted overhead. Um, and then I stopped doing CrossFit, I don't know, probably a couple of years ago, started doing more like lifting. I will say, I don't look like I lift very heavy weights, but I was progressing pretty, relative to what I can do. And in probably January, I started to have a lot. So I actually couldn't do a lot of internal rotation. So my internal rotation was probably limited to here and it was painful. So it was like in
Mhm.
the front of my shoulder, painful. And that has been for years. Um, Whereas I have like I can beat my hand in my mid back, in the middle of my scapula. I can put my left hand. So I know that I have a mobility restriction there on my right side. But that has been not been as painful as it was until this January. And it got to the point where like I'm not doing this during the day. So obviously
Right.
that's not what bothered me. But every time I would lift, I would have a lot of really sharp pain in the front of my shoulder. Then you know, I just dealt with it. It was one of those things where I think 2 weeks before I came to see you, for your course, I was benching.
Mm,
And that's when I was just on the descent in any sort of eccentric. It was so painful, and I was like, "I just can't do this anymore, like, this doesn't work." So I lowered the weight, I was fine. But it was bugging me. When I came to see you, I was having trouble with a lot of, like, just range of motion. Like, it
yeah.
wasn't feeling good, and I was noticing a lot of, like, if I would pick something up, especially, like, long head of the biceps type test, if
Mhm.
I would pick something up, I would feel like I wanted to give out.
Mm.
So, like, it wasn't feeling great. And I was going to play volleyball. So, when I come to California, I like to play volleyball. So, when I came to San Diego, I was like, "I wanna play volleyball this weekend.
Yeah.
I would love if you could treat me." So yeah, that's the long and the short, I guess.
Was this I can't remember if this was before or after you did the bunch of the indoor volleyball back at home too?
That was af
Af
before. That was
Before.
before.
Okay, because
Before,
I
'cause
feel
that
like that
yeah.
was part of the what might have flared you up too, is like a full day of indoor volleyball. Right.
No, it was after the volleyball started after because I decided basically, I came here and I was like, "I wanna play more
Oh,
volleyball."
gotcha,
And then I
okay.
started playing, but that was part of the test.
Yeah,
Because every time when I would come here,
yeah.
after playing the times before this time, I would
Uh-huh.
go home and my shoulder would hurt from swinging.
Gotcha, okay.
So, that was definitely something that always bothered it.
Gotcha,
And I would notice it I didn't even mention this, but, like, in high school, my senior year of volleyball, like, I had shoulder pain.
gotcha.
So,
Yeah.
that
Ok
was what had aggravated it. Now it
yeah,
started it, but certainly what
okay,
aggravated it.
yeah. Alright, yeah, so because I ended up seeing Lex twice in the last 7 months.
Mhm.
And so the first time yeah, she came to me and like she said, like a lot of range of motions were bothering her. She was not even comfortable really like laying on the table.
Yeah. Yes. Oh my god, yes.
She kept on like
Yes.
she literally couldn't find a comfortable position for her shoulder.
Yes. Yes.
And she I know how it came up even, is I asked you because you were our model
Mhm.
that for scoliosis, and we chose, like, an overhead squat as your
Oh,
or maybe
yes.
not an overhead squat, but, like, a back squat, something that involved a barbell
Yeah.
in your arm, and you're like, "Oh, well, my shoulder's been bothering me."
Yeah.
2, and then I'm like, "What?" And so we use as an example of how I meet the body where it's at was for scoliosis, which we that was why you were on the last podcast, we talked about that whole
Mhm.
experience, so I'll link
Mhm.
that in the show notes, but, um, so then I was like, "Well, yeah, let's make sure we treat your shoulder before you go up and play volleyball," and it was at 9 o'clock at night. We had done the whole day of teaching, and then I always for the mastermind, I treat the group to dinner, so it was
Mhm.
after dinner, and the you got home and you're like, "I hate to ask you, but" I was like, "When my shoulder, like, are we gonna get to my shoulder?" I was like, "Yes, actually, yes, let's." So I put the table up and I was like, if we only do 20 to 30 minutes, like, at least it's a start."
Yeah.
And so I did the LTAP on her. And so again, the LTAP is an acronym for the Locator Test Assessment Protocol. And it basically is a series of tests that gets me to where the body wants me to start treatment in terms of it directs me to where the body is protecting because when the body is protecting something important like visceral organs or the central nervous system, then the whole musculoskeletal system sort of like goes into a like a hug or like a pattern of protection. I just told people on the results sheet code this week, I was like, it's almost like the pattern you see when somebody has appendicitis, right? They're bent
Mhm.
over and their side bent to the right. Like that is your body going into a severe protection pattern for something. So same thing, like when we have a protection pattern on any visceral organ from a, disease standpoint, a limited function standpoint, or just the organ is not able to move within the container because of its ligaments being stiff or the space being limited for whatever reasons, um, the body goes and it sort of arranges itself around that structure.
Yeah.
On top of that, you'll get visceral referred pain from the nerves in the relationship to the nerves to that organ and then the rest of the body. And so the LTAP helps us to figure out where, because when we can do treatment in that location, we get people out of their protective response and we see a completely different picture of their posture and their movement patterns when they're not in that protective pattern. And so many times their protective pattern is what's making something hurt.
Yeah.
so, um, so her assessment um directed us to her liver and her central nervous system. So what I did on her is especially I guess if for those of you who've gone through the results cheat code just coming off of the 3 free week of it. So what her assessment would have looked like is her SI joint was hypomobile on one side. I don't honestly don't even remember what side it was hypomobile on, but it kind of doesn't matter. But
Mhm.
one side of her SI joint was hypomobile, but when she held her breath, it became mobile. And so that directed me to the central nervous system or the viscera. Now, the rest of the LTAP was able to tell me it was actually first round was not central nervous system, it was liver. So I treated her liver first. And then before I treated her liver, we looked at her shoulder mobility and her
Yeah.
shoulder function. And like I said, in a supine position on the table, she had a hard time finding a comfortable position. So just that passive, like I guess that would be passive shoulder extension was painful to her.
Mhm.
But then when I tested her abduction, she had resistance very soon in her abduction range, which is like technically a upper limb nerve tension test.
Mhm.
Um, I think I also did like a traditional like a median nerve glide, and that had a lot of tension on it. Like pretty immediately when I started to extend your elbow. Um, and she was lacking upward rotation and protract like general upward rotation of the scapula was
Mhm.
lacking, and definitely, like she said, limited internal rotation and very limited horizontal adduction, and those two were painful.
Mhm.
And I don't think the passive abduction was painful though, but it was very resisted, and I could. It's almost like your whole glenohumeral joint was not inferior gliding very well
Yeah.
too.
I
Yeah,
remember you saying that.
yeah. So again, because we were in a limited time crunch, I was like, this is enough objective information. Like, yeah, clearly your shoulder is limited in mobility and unhappy, and your scapular mobility stability is not great. So
Mhm.
let's see how it changes. So I did a really simple liver treatment on you. I believe I think I did a liver lift, and then, like, maybe that one where I'm, like, hugging you from the
Yeah.
side. Yeah.
Yeah.
So, like, a three-dimensional, like, induction of the diaphragm and the liver together. Um, and, then I was like, "Okay, we treated that, and we laid you back down and retested stuff." Her SI joint was still hypomobile, and it still changed with a breath hold, so it's telling me there's still another layer of protection pattern either in her viscera or her central nervous system. This time it was her central nervous system, which is the second test of the LTAP. So I tested that, and that was confirmation. And then I retested you before I treated that. I retested your shoulder objective things, and you were much more comfortable laying on your back. In
Mhm.
fact, we noticed too, like your rib hump from your scoliosis,
Oh,
like was totally
yes.
different. Totally,
Yes.
almost, almost new. I don't want to say I hate the word neutral, but like almost looked like the other side. Like you could barely tell that you even had a rib hump there.
Yes. I forgot about that.
Yes, and then your shoulder abduction, it was like, "Oh, no problem." There was still, like, a little lacking in, inferior glide, but, like, it was, like, so much easier to go into hip shoulder abduction, and then it gave us a little, adduction and improved your internal rotation, and I I think I think already with just a liver treatment, you didn't have any pain, but I was like, I think I could get you better range of motion by doing the central nervous system piece. So then I went to the central nervous system piece and I did a little work in like your C4 area. a little cranial piece, like greater nerve of Arnold, sort of occipital nerves. And I think I did one little brachial plexus neuromanipulation thing. And then we retested everything, and your nerve tension was almost completely gone. The rest of your glenohumeral joint inferior glided, and then your adduction finally could come across your body as, as good as the other side.
Yeah.
And you're like, "Oh my." We were
Yeah.
both like, "Oh, there you go."
Cool.
And then I was like, "I know she's gonna go play beach volleyball in the morning and, like, fucking jack it all up." And then you messaged me because I was like, "Well," I was pretty confident that you would feel better, but I was
Mhm.
like, "I don't know, the volume of volleyball she's gonna play and how much pain you were in," I was like, "Hopefully, she doesn't mess up what I just did." But, um as with everybody, I'm like, I'm just always curious. I'm like, "Go do your thing." I never tell people not to do stuff, and so I'm like, "Go do it." Like, let
Mhm.
pain be your guide, and, from a home exercise program standpoint, I would have you do, breathing and liver work or, like, thoracolumbar junction rotational stuff and, see how you feel. And then like, maybe 5 days later, you sent me a Voxer and it was like, "What the I feel amazing." And I was like, "What?"
Yeah.
So I'll let you tell that piece.
Yeah, I've had 0 pain since then, so
Yeah,
I've had nothing, like,
yeah,
I will say, like, you can see, like, my hand is in the middle of my shoulder blades right now,
yeah,
like, I have no pain,
yeah,
um, so that was great. That's been amazing to
yeah,
not have any sort of shoulder pain. I will say I was surprised about volleyball because of the amount that we play and just how many swings, the
yeah,
volume of swings in a weekend, a very short amount of time,
yeah.
and I had no pain at all. I went right back to lifting. I went right back to doing all the things. I had no issues at all. And I was skeptical up until like month 3. And I was like, when is it going to return?
With
I
yeah,
was waiting and waiting and it never returned, and I was like, "Well, this is cool." But I will say, like, because I am going to be honest right now,
yeah,
um, throw myself right under the bus. I am the worst person to, like, do something about my pain. So, I have tried with my shoulder, I was like, "All right, cool. I'm gonna do some overhead kettlebell upside down presses. We're gonna work on some stability. We're gonna do some." I was told over and over again by a couple different people, like, "You just need to work on your shoulder stability. You'll be fine, yada, yada." All the scapular squeezes. I've done all the I lift with good form. And I'm like, "Okay, I'm a PT. It's still not going away. I'll just leave it." Like, and I wasn't gonna go consult someone just for my shoulder. It just didn't bother me enough to do so.
right.
And then it was like until it did, obviously. But
Yeah.
so when that like the reason I mentioned that is because when I got home, it's not like I was doing your home exercise
No,
program.
no, you're right.
Like, I'll be honest, I don't want people to feel like, "Well, what did she do between?" I did nothing. Like, Anna Anna sent me a video, and I did 1 round of this, like, ball on my diaphragm and rib cage area, and I was like, "I think I'm good."
I'm good.
So, I did nothing. Anna did the only treatment, and then, like I said, it was like a 30-second, "I'm gonna give this little ball a try."
Pain is a great motivator.
Yeah.
Um, even though you didn't do the home exercise programs I recommended, you did start honoring your curves a little bit better.
Yeah.
Yes.
Yeah. Yeah.
Which so again, like, honoring her curves and scoliosis, I think, helped a ton with
Yeah.
it sticking because then she was meeting the when you honor where the curves are and when she propped herself properly, her body naturally gave space around the area of the liver, and then everything's gonna function better. So
Yeah.
that I think even though you don't think you did anything, I think the awareness and, like, the accepting that it was okay to meet your curves where you're at, because before that, you felt like you had to, like, organize your
Yeah.
body in some sort of weird way because you had scoliosis, and I was like, "No, just lean into it a little bit. Let your
Yeah.
body organize itself." And so I think that did help a lot.
Yeah.
And then, yeah, the second time I treated her was more because I was visiting her in May? April?
No, it was March.
March? Did it?
It
Oh,
was like 2 weeks after.
no, it was longer than that because
April? Oh,
it
it was
it was April. Yeah, the
yeah,
3rd week
early
of April.
April? Yeah.
Yeah, so, like, maybe a month later,
Mhm.
I was on the East Coast and had a few days off, so I went up to New Hampshire to see her. and, like, more just socially, but while
Yeah.
I was there, I was like, "Hey, I wanna do the diaphragm and liver treatment on you one more time," because of what I felt in my own hands, because when I
Oh,
treated
yeah.
you in March, it was literally the stiffest diaphragm I've ever felt before,
I remember you saying that.
and I was like, "Oh," which is another reason why I was like, "No way this is gonna stick."
Yeah.
Without especially without you doing the exercises, and so, I was like, "Lex, I would just really like to get my hands on you also out of curiosity, because I wanted to feel your diaphragm again." Because I
Mhm.
was like in my head, I'm like, did it make that much change with one treatment that you're still not having pain?" And I was like, I just feel like it would be better for the both of us, my brain and your body, if I could get my hands on you again. So I did another treat, and I didn't even do a full treatment on you. It was literally like I did the assessment to make sure that was like that I was close to what your body wanted, and
Yeah.
it was where you're listening, like, where your LTAP was taking me again, and so I was like, "Okay, perfect, we'll do it," and I did it, and her diaphragm, though still stiff relative to other diaphragms I feel, was so much better than it was a month before, and it was I mean, it was so much better that it didn't feel it didn't feel out of the ordinary. It felt like a lot of other people's diaphragms that I feel. And so that was really cool too for me to see like how well you did keep it, which again, I think is because you were honoring where your curves were and letting your body organize itself. And then I did just give it enough information. And I feel like too that one of the other reasons why things got such good results for you is because we didn't do a lot for treatment.
Yeah.
We went right to where the body needed me to do something, and we did something there, and so then the brain could focus on what it needed to do to keep that area happy, and I didn't confuse it with a bunch of manual therapy in other places, which is probably I know it's the hardest thing for me to
Mhm.
do with my patients is, like, know when enough's enough.
Yeah.
In the Barral Institute, Jean-Pierre is always like, it's, leave a little some like, leave some on the table, like, let the body do its job, like, don't overtreat is like a message of their courses, and I mean, I feel like every single practitioner that goes through their work, like, overtreats. I
Yeah.
feel like every practitioner in general overtreats, and so I actually think the fact that we only took 30 minutes to treat you the first time is part of the reason why you had such great outcomes as well.
Yeah. I feel
Um,
like
which
on
is
that note, there's 2 things that I wanna say
yeah,
that I feel like people might not be hearing yet. The way that your treatment feels, right? So, like I said, I don't seek treatment, but I have treated people.
right,
So, the way that your treatment felt was very minimal. Like, I
yeah,
was like, "Did we do anything?" Like,
yeah,
honestly, like, it didn't hurt. I wasn't, like, biting a pillow and taking a rock blade, not that you would ever do it with a rock blade, more or less like any sort of, instrument where you're pushing me to, like, cry, like, there was
yeah,
none of that. There was no sort of, I'm gonna pin and stretch you, do all this stuff, like, all the touch was very gentle,
yeah.
and you didn't really touch my shoulder.
No,
Like,
I
you didn't treat my shoulder.
just assess it really.
Yeah, yeah, like, you assessed it, but the treatment was not there, and for me, you know, yes, I we all feel that, you're going to have to do something to that area for the person, obviously, like, put up the fire out, touch the area, whatever, but, like, we had limited time, and in that limited amount of time, you didn't treat my shoulder, you treated everything else, and I feel like had I gone somewhere else, I would have had my shoulder treated.
Yeah, for
And
sure.
I don't know what that would have looked like, whether it was dry needling, cupping, whatever it may be, but I think that would have been a huge a miss because now I have multiple visits when you treated me in 30 minutes.
Yeah. Yeah,
You know
for
what I
sure.
mean? So it's like I don't know if I understand the treatment is going to be different for each person, but like when for me internally I was like, "Wow, I just saved myself a ton of time and
Mhm.
I feel fine. I feel perfect with that treatment and there's no need to now go 3 times a week for however long or even once a week for 6 months."
Right.
Like, you know?
Yeah.
Um, I
And we
also
were prepared. I mean, I had gotten the cups out and the needles, like,
yeah,
I was
you
prepared.
did.
Yeah,
Yeah,
I was
you
like,
did.
"Oh, fuck, this is gonna, like"
Yeah,
her shoulder really hurts. We were both surprised
yeah,
at the outcome. And that's, like that is, like, every day I treat someone, I am constantly surprised.
Yeah.
Because my assumptions based on my first 10 years of practice
Mhm.
are always blown out of the water with what actually happens in front of me when I'm paying attention to the body.
Yeah.
And also it's just goes to show is like, like you said, you've done a million exercises and even with the scoliosis, like the whole
Yeah.
like I let your body organize itself.
Yep.
Movement is an outcome. And so like how can I change the inputs so that I get the preferred outcome?
Right.
And I that was a really good example of what we did. So
Yeah.
yeah, so I treated you that second time and then yeah, you've literally done nothing and you play volleyball all the time and you lift and
I'll say I literally play volleyball probably 8 plus hours a week. Like,
yeah.
I have no issues, and I will say, like, I'm sitting here touching my ribs because that was, like, an aesthetic thing for me.
For
I hated that. So, like, whenever I'd lay down on my back, you could very much so see a discrepancy in my ribs, and it was always something that I was self-conscious about, and I didn't love it, and I always thought, like, "This is the way it is, this is the way it's going to be," and when that was the same, I almost lost my mind.
Yeah, you got a little, like
I got emotional. I was
yeah,
like, "What?" Like,
yeah,
this is different, and I'm touching it now, and, like, it's definitely way less pronounced.
yeah, oh, I'm sure.
It's
Yeah,
way less pronounced, and, like, when you talk about my diaphragm being the tightest that you ever had felt, like, it all makes sense.
yeah,
But for that to be a big change too, like, mentally for me, that was awesome.
yeah.
That was
Well, and
awesome.
it goes and again, like, I think too, like, diaphragm was the tightest I ever felt, but yet it just took one treatment for it to change, and the reason being is that the tightness was a neurological thing.
Yeah,
Yes. It
yes.
wasn't I mean, I'm sure there's a little bit of layered upon, like, stiffness in certain
Mhm.
areas from your scoliosis, but the majority of what was happening was the diaphragm was splinting the liver. The diaphragm was like, "I don't want you to like, we cannot move. Like, we're not going to allow any more movement here because something might hurt the visceral organ."
Yeah.
And so as soon as we like did the treatment around the organ itself and got it to gently move and like she said, yeah, it's everything's really gentle and even I did a visceral manipulation technique on her which is gentle in general. But even when I do cupping or even when I do exercise, anything I do, I'm always doing it over in that protection position, and so
Mhm.
it never is gonna feel, like, threatening and forceful, and of course, too, then I back off depth if it does, or I back off intensity if it does, because I know that the safety is, like, such an important thing that the patient needs to feel in order to tap into the body's ability to heal, that
Mhm.
why would I do anything to contradict that?
Yeah, I liked watching you cup in that way.
Yeah,
Because I saw you do that. That was the first
yeah,
time I had seen someone go with the way that like, the
yeah.
least
Go
restriction.
into
Peop
the ease, yeah, the direction
Yeah.
of ease, yeah,
Yeah, direction of ease. People don't really do that. They go in the opposite direction because that's
yeah,
what needs to be mobile.
yes,
But so when I had watched you cup, I think you were cupping Shantae, and I was
yeah,
like, "This is really cool."
yeah.
Um,
Oh, yeah, I forget that you did see me treat her one day.
yeah.
Um Yeah, the other thing too is like, it doesn't mean that I never do because that's called an indirect treatment. It's not like I never do direct treatments and like go into the tension, but I only go into the tension when the body takes me there and
Mhm.
like clearly wants to do that. And in my experience, it's usually only after I've gone indirectly into the ease that
Yeah.
then it sort of reorganizes itself and then opens up into the tension and we can get more out of it. So, and that's a little bit too of like, I always give everybody goes through my education. And even in the podcast, I did like an intro to movement rev methods and philosophies. And because that is a very osteopathic philosophy that I learned through the visceral and neural manipulation from the Burrell Institute. And it's not like I mean, it's not like they out and say it, but it's like as you're learning the osteopathic techniques through them, those principles are conveyed. And I
Mhm.
recognize that it was in direct opposition of traditional sports medicine. And I really felt like if I was gonna take this stuff on, then I couldn't just be doing half my other treatments this way. It didn't make
Yeah.
sense,
Mhm.
right? There was a lot of dissonance between the 2, and I was like, if I'm really gonna assimilate the information together, they need to resonate with each other, which means I need to decide what philosophies make sense to me and see and here is this is almost like a way to prove, like, things are true. If the philosophies are truly true, they should be able to work with any technique.
Yeah.
And so then I took the techniques from the traditional stuff that I love to use, like the cupping,
Mhm.
and I was like, "Well, let's just do it on this philosophy and see what results I get," because I already get good results from just the tool. And then that was when I was like, "Wow, I get even better results." And
Yeah.
so that's when I realized too that it's like, no, the principles are more important, which, and it always goes back to um, Emerson, not Ralph Waldo Emerson, but, Har Harrington Emerson quote about principles and techniques. The
Right.
fact that we learn techniques in order to understand principles, but once you understand the principles, you can make up your own techniques.
Mhm.
That is exactly what I've done,
Yeah.
is taken these principles of osteopathic medicine and applied them in a new way with old tools.
Right.
And that's what you felt, is it was very gentle, and it was gentle, yet so profound and impactful.
I feel like I'm gonna pretend like you planted this question. She didn't plant this question for anyone watching or listening, but I want to ask it because I feel like people who are like me, I have not taken any Brawl classes. I know
Right.
nothing about osteopathic listening, other than what I've watched Anna teach. But for me as a PT, if I were you and I was treating someone like myself, for the treatment, obviously you used osteopathic principles to treat me. Like you
Mhm.
did the diaphragm release, you did a
Oh,
liver
tools.
treatment.
I
Tools, yeah. So what would you do differently
use tools.
if you didn't have those tools?
Yeah, I I would have used the dynamic cupping
Mhm.
around the anatomical borders of the liver, or, like, around the whole area of the liver. I probably would have gone and done some sort of spinal mobility, either manual therapy or, just movement at the segments that innervate the liver, and then, which are think T7 through T9, maybe T10. And then I would have gone to C4, C3, 4, and 5 and done some manual therapy there. Even your body took me there anyways, but I
Yeah.
would have probably done it in either way because that's where the phrenic nerve comes out and that's the sensory to the liver. I would have done some side bending and like the exercise I gave you for
Yeah.
home care, like cortisol, the sideline breathing. I probably also the other exercise I gave you was the Da Vinci rolling pattern, so I
Yes.
love the rolling patterns for that area of the body.
Yeah.
The reason why I love Da Vinci rolling specifically is because it does opposition and it twists it emphasizes rotation at the area and the diaphragm, that's, like, the best way to stretch it isn't rotation. So the Da Vinci rolling with actually a pause while you're twisted and breathing into that area,
Mhm.
like, that's how I would have mobilized the diaphragm the most. And then probably done some sort of, like, segmental spine thing to work on the articulation of the liver and the diaphragm like a ball and socket joint.
Cool. I ask because I want people to know you don't have to
Yeah,
understand osteopathic, tools in order to
right.
treat.
Yeah, you
You
don't
can
have
use these
to
principles.
right, you don't have to have visceral manipulation or neural manipulation tools. You just and that's what I teach in my courses and
Mhm.
in terms is like you already have tools that can affect the viscera. It's just you don't realize that they are affecting the viscera. So
Yeah.
I'm just giving you a new lens of view so you can see that a spinal roll down is this articulation of the diaphragm over the liver. And you can even cue it that way. And when you cue it from the deep from you when you use the organs as imagery cues to cues movements, the movement quality is very connected and very deeper. It's a totally different experience. And so, um, but yeah, like tools that I've been using my whole career that I just use now for different reasons. Yeah.
Yeah, and, like, we've talked about it between us 2 of, like, treatment is chalked up to be super sexy. Like,
Yes.
do all these sexy things for
Yeah.
treatment. But, like, if you don't actually start where the body is telling you to
Yeah.
start,
Doesn't matter.
like, great. Now you're either wasting the person not wasting the person's time, but you're making them come for longer, you might be
Yeah.
missing something.
Yeah.
So, it's just
Yeah.
I think the assessment part, like, learning from Anna and watching Anna teach and being a part of her community has definitely, drove home the principle that assessment is the sexy part. And when you nail the assessment, then the patient is happy, you get good results. There's really no, there's no negative when you're
Yeah.
nailing the assessment.
100%. 100%. The assessment is the sexy part,
Yeah.
but yet it doesn't sell.
No, it doesn't sell. All those tests, they don't sell because we had
No.
to memorize 60 shoulder tests for
Yeah.
a comp, and everyone's like,
Well, and that's the thing too, like, assessment is sometimes different than special tests.
"That."
I think
Yes.
I think both physical therapists and athletic trainers were beat over the head with orthopedic special tests in school for our assessment, and you don't need to use them at all
No. Nope.
because half the time the doctors I mean, like, I guess you can use them. It's always nice to arrive at the same diagnosis as the doctor, and I do use them occasionally. But when somebody
Mhm.
comes to me with ankle pain, I'm not doing the anterior drawer and I'm not looking at all the different ligaments,
Oh,
right? I'm being
yeah,
like, "What's your general range of motion? What's your swelling like?
yeah,
Is your fibula moving?
yeah.
And what's your mobility like, again, what's your mobility
Well,
like?
yeah,
What's your strength like? Can you
yeah.
rise up on your heel with a straight and bent leg? Like, so I think we were so mind fucked over
Mhm.
assessment being special tests
Yeah.
instead of actually focusing on the word that it was called special tests.
Yes.
So special tests mean you're gonna use it at a very special, specific time,
Yes.
not always for every assessment. And I
Yeah.
remember finishing school, and I'm sure you were like this at a PT. You get your first shoulder in, and you do like the clunk test, and and the slap test, and the this test, and then that test, and
Yeah.
then you're like, well, "What the fuck am I supposed to do? I think it
Yeah.
might be a labral tear, but what am I supposed to do now?"
Everything hurts.
And it's like, yeah. But then also they probably came from the doctor who already told you it's a
Yes.
labral tear. And how did they know? Is because they did the special tests in the office and then
Yeah.
sent them for an MRI
Yeah.
and physical therapy. And so it's like, what the fuck? Special
Yeah.
tests is not an assessment,
No.
period.
No. No.
So,
Boom.
boom.
Mic
And then
drop.
so it's like, yes, assessment. And as I showed with Lex, I still do a movement assessment. Like I
Yeah.
still look at passive range of motion and
Mhm.
active motor control and strength and all those things. But I'm not surprised when I do a simple technique on the liver and then it totally changes everything. It takes
Yeah.
a shoulder who tested like a 2 out of 5 on a manual muscle test, and all of a sudden it'll test 5 out of 5.
Yeah.
So, it's not a strength problem,
Right.
or sometimes it is a strength problem, and it becomes more and more clear then, like, the last podcast episode talking about Daniela, like, she did have a strength issue, but it actually got more obvious that how weak she was, the better her body was organized getting rid of the protection pattern,
Yeah.
because it wasn't allowing her to compensate.
Right.
So I was like, "Oh, yeah, look at that. Your serratus anterior is really weak. You can barely do 2 wall push-ups. It's 2 single arm wall push-ups." Like, that's a strength thing.
Yeah.
Yeah. But also her pain and her strength, we like to
Ah.
correlate those 2 things. And just
Yeah.
like you, your pain and your strength, did you have some weaknesses? I'm sure. But your pain and your strength had nothing to do with each other.
Yeah.
We blame strength we blame strength as the pain driver so often when it's not.
Yeah.
And it's a lot easier to strengthen something when it doesn't hurt. So
Right.
first we got to get rid of the pain somehow. And so it's like I always tell people it's bullshit to tell your patient that the reason something hurts is because they're not strong.
Yeah.
Because that is like telling an overweight person that their knee pain is because they're overweight. They're gonna fucking lose the weight and their knee's still gonna hurt.
Yeah.
They're gonna get strong and their knee's still gonna hurt.
Yeah.
So
I'm
yeah,
just picturing, like, how I would have reacted if you would have told me, like, "Oh, just do some strengthening." I'm like, "Fuck off. I already do that and it hurts." Like,
yeah,
I'm not gonna do more.
yeah. So that's the
Yeah.
thing too is like the more we can undo the layers of the protection pattern, the clearer and clearer what the true actual objective dysfunctions become.
Yeah.
So
and then just get rid of the rib pump, and that's a total, just a side benefit that I absolutely love.
Yeah. Yeah. Exactly.
I
Aesthetically.
love it.
All right. Well, any like parting words of wisdom? That was a good I liked that question from you.
Um, I want to say that, and I wanna this is my thinking face. I have to put the words together
Yeah.
first. I'm not very quick on my
Well,
feet
that's
with
funny. I was
words.
saying your eyes are directing me that you're thinking about auditory something.
Really?
Yeah.
I I wanna say that if being in the clinic, right? So I've had a lot of different education. When you come out of school, you feel like you know nothing, quote unquote. You could probably do, like you said, all the special tests in the world, and then, putting things together, it's kind of like, and it really depends on your CI, like how well were you educated on your clinical rotations, et cetera, at least for a physical therapist standpoint.
Yeah.
And then I was exposed to a lot of like pain science, rock tape, all of that stuff. Loved it, implemented it really well, really started to put the pieces together. Went through Herman and Wallace, did a lot of like learned about pelvic pain, did McKenzie treatment, right? And I feel like as a PT, I could make people feel really good. Like I knew that I did my job very well, but for me, I think back to the patients that if I had the skills that you teach, how fewer visits they would have had, but also just that little 10% that I could have just like they were at 90, like could I have gotten them to 100%? And they're like walking around the world right now. And I'm just thinking about them and I'm like, I wish I could go back in time. Right? So like if I had like words of wisdom, I would say like this would be something to invest in because it's such a when you think about assessment being sexy, the assessment that Anna teaches, it's not like it's going to take over your entire practice.
Right.
Right? So it's like she's not telling you to ditch everything you ever learned and just learn what she is teaching you. It's more or less like this is what's missed. We do come out of school and we're like, we're the PT. I'm going to solve your pain rather than being like, okay, what can I learn from you too? And
Yeah.
like that's something that I've learned from you over and over again over the past, 5 years of like hearing you talk like we're not the expert. We have to understand where the body is coming from. And inherently, I think we all know it. We all know that everybody's different. We all know that the body's my shoulder pain is very different from someone else's shoulder pain. So if we think in that realm, if we have the same exact injury and we respond differently, why wouldn't we want to consult the patient's body first?
Right.
So I'm like, it makes sense. And so if anyone is wondering, like, yes, I've seen Anna teach in person. I do recommend, getting to an in-person class because it is great to just feel Anna's hands and like understand what things feel like. Um, but if you have the chance to take any of her courses that teach like the LTAP course, like that is what I would recommend it 1000%. And that's not just because I'm like, I support Anna and I work very closely with Anna. It's because I've seen it happen, like make a huge difference, not only in my life, but a lot of other people.
Yeah.
And it's wild.
Well, thank you.
It's the best, of course.
Appreciate that. I'll pay
So
you later. No, just kidding.
I say she told me to say all that. I have a script on my computer.
We all know I'm not that prepared.
I literally was no. I love you.
So,
You'll get a Riverside link right before, and I was like, I expected nothing else, Anna.
yeah.
This is the
Yeah.
best.
Yeah. All right. Well, I
I love
appreciate
it.
you. Thank you for being here. I'll drop all the things in the show notes and yeah.
Thank you so much for having me. This is great. We had a great 20-minute episode.
Yeah.